Hello and welcome everyone to our second edition of an on the road webinar focusing specifically on DOT. My name is Jacob Allman. I'm the product marketer here at Verified First. I'm just going to go through some quick housekeeping for you guys as you trickle in. If you've been on one of our webinars before, you kind of know the spiel, but the reality is we're on Zoom, so there's two different ways to kind of contact us during the presentation. First is through the chat function. If you guys don't mind going into the chat so that we can see that it's working, maybe tell us where you're joining us from, what the weather's like. I always ask that, but also, what is your role in DOT compliance at your company? If you're comfortable sharing that. And that way we can kind of have that open discussion. We also book time at the end of the presentation for a Q&A session. You can either put that in chat, but the preferred way would be the Q&A function, which you should see on your Zoom UI there. Basically, that allows us to address them sequentially. If it ends up in chat, don't worry. We'll address it either way. And then if we don't get to it during the presentation, which I'm hoping not is the case, but if not, we'll get back to you afterwards. There'll also be two poll questions that'll be real quick during the presentation itself, and an after event survey detailing some questions around the event itself that we'd love if you guys would answer. So with that, let me introduce Alex and Grant. Well, I'll let them introduce themselves, and then we can get into the presentation. Alex?
Great. Well, nice to meet everyone. I'm Alexander Purcell. I'm the DOT Solutions and Support Engineer here at Verified First. And my background is really in the transportation and trucking industry. I've got almost 2 decades now. It kind of hurts to say that every time because I'm getting older and older, but going a lot of years on just DOT regulations, compliance. My main background is on audits and enforcement. So I've done hundreds and hundreds of on-site, off-site investigations, compliance reviews, corrective action plans, new entrant audits, things like that. So that's a little bit of my background, and my job's to make sure that Verified First clients or people that are looking to switch to Verified First are compliant, their workflows work well, and make it as operationally efficient as possible.
Thanks, Alex. And I'm Grant Ricks, and I just want to thank you all so much for hopping on board today, whether it's morning or afternoon. I see people popping in from all over the country. So thank you for being here. It's always a privilege to talk to you all because we as a company grow and achieve certain standards based upon your feedback and your opinions, and your voice matters. So we love doing those things because we love hearing your involvement. And we've come a long way in the DOT space thanks to Alex, and he's our pre-employment and compliant guru. So I can't wait to hear what Alex has to say as well. He's got the mic most of the time, but I'll be filling in some gaps. And so I look forward to talking to you guys about the gaps and the DOT world.
Awesome. Thank you guys so much. I think we've got everybody who's joined in now. And again, just to echo Grant, thank you for joining us today. And with that, let us get underway. I'm going to pretty much cede the floor to Alex. We kind of really already touched on this slide, so we'll get into more of the agenda itself. And with that, these are just some of the topics that we're going to cover. Alex is going to go through them one by one. And like I said, there'll be a live Q&A and discussion afterwards. But with that, before we actually kick off, I was misleading there. I wanted to actually put together a quick poll just based on something we're going to talk about in this actual presentation. So if you guys can see there, it's pretty much centered around your audit readiness. And let us know if you can vote and go from there and see how that would work, which now we see the answers coming in, which is great.
I love the first question. If you got audited tomorrow, like, are you ready?
Awesome. We'll let that roll for a little bit. Great. So with that, I'm going to leave the poll up for a little bit more, but then we'll kind of start off and I'll let Alex get talking, and then we can kind of go back to the actual results here as we kind of wrap up.
Yeah, and Alex, you can probably talk about this some other time or today or whenever you want, but give like a 1 minute spiel about your background with audits and how many you've been through in the DOT world and how many you've seen like pre-audit and then to the auditors and
Yep.
kind of your experience in that world.
Yeah. So yeah, I've done quite a few audits. Most of them have been new entrants and what's called CRs, compliance reviews. So most of the time, the compliance reviews are non-ratable. But what a lot of people don't understand with non-ratable reviews is what it pretty much means is it's a way for the FMCSA or the state to pretty much go through a company, see what they're doing right, see what they're doing wrong. And then what'll happen is they'll usually discover some type of violations. If there's serious violations, of course, there can be, civil penalties encountered by that. If they're, non-serious, it's just kind of a slap on the wrist. But the biggest thing with audits that a lot of companies don't understand is, it really depends on the auditors. The regs are the regs, they're black and white, but a lot of times certain states they'll focus on certain things. So like I'm just giving an example. If Georgia is having a real high uptick in drug and alcohol violations, that's what they're going to focus on. If California is really focused on inspections, your pre-trip inspections or things like that, they're going to want to look at that. So there's the quick summary is there's three parts to an audit. There's going to be the company. So how quickly can you generate records? How far back do they go? Are you compliant with that? Do you have the right formatting? Things like that. The second part is going to be the equipment. So, the type of equipment you have, your maintenance logs, your registrations, your permits, your tags, things like that. And the third one is going to be the drivers. And that really depends on the auditor. The auditor might go, hey, you've got 200 drivers. I want to see 20 of them. Or they might go, I want to see 100 of them. They'll usually look for drug testing, MVRs, PSPs, queries. They'll look for consent forms. They'll look for everything. So the big thing with audits, I tell everyone is, I know it's kind of a scary question, but it's kind of a good mindset to have is if you were selected for an audit or investigation, regardless if it's rateable or not, so that means there's financial penalties connected. In other words, how quickly could you generate, 3 years worth of drug testing, background screening, vehicle information, your tags, your permits, if the different things like that. And it's not just CDL, it can also be non-CDL. So I hope that kind of gives everyone a little bit to kind of think and go over, but that's kind of a quick overview of it.
Well, you brought up right away non-CDL. Can you just describe the difference between CDL and non-CDL?
Yeah, so the main thing is CDL obviously has mainly just a lot more drug testing involved. Of course, it is required under Regulation 382 for all CDL drivers. But one thing a lot of companies will run into, and this is one thing I see the most on audits, a lot of companies, they'll think CDL is only like a semi. Like, oh, well, we don't have an 18-wheeler, so we don't have any CDL drivers. Well, if you have a pickup truck and a gooseneck trailer, that can put you in CDL territory a lot. So a lot of construction companies, utility, oil field, things like that, they might think they're non-CDL just because they're not operating a vehicle that's, a semi or has full air brakes. But if they're over that 26,000 pound mark, they are. And the 26,001 pounds is not just for the power unit. It can also be CGVWR, which is combined gross vehicle weight rating. So what I usually tell people is if you have any diesel pickup trucks, you potentially could be at risk of having CDL drivers and not know it. And then the kind of caveat to that is if you have any gooseneck trailers, there's usually a reason they're gooseneck. It's because they can pull more. So if you have a diesel pickup truck and any gooseneck, you probably have CDL equipment and you don't know it. So just that's something we could probably talk about later, but just something to kind of keep in mind.
Awesome. Thank you, Alex. Talk a little bit about, pre-employment testing and how that, factors into this entire process.
So pre-employment testing, the big thing to keep in mind is how the regs read is you have to have a negative drug test and a non-prohibited query back before a driver can be in a safety sensitive position. So the layman's term of that is before they can, turn the key in on the truck, right? Or push a button these days. So what that looks like is a lot of it has to do with recruiting and HR. Drug testing is often something that can really hold that process up. So one thing that Verified First is very good at is we have the largest network. We use all the networks. So eScreen, Quest, LabCorp, Concentra, FormFox, we use all of them. So that means that's going to give you the most potential for close locations. You don't have to worry about sending drivers, an hour down the road. You're going to have something there. So the idea is with pre-employment, you got to have that negative drug test. You got to have the query, and having close locations is important, but also having electronic chain of custodies. That's something I see a ton of. You do not want paper chain of custodies. If you have any of those, that's a huge headache because you have to have those for audits. So the last thing you want to worry about is some driver or someone saying, "Hey, here's this piece of paper. I got my drug test back." Well, you got to maintain that for 3 years and hope it doesn't disappear or get, swallowed up in a filing cabinet, right? So having electronic chain of custodies is going to allow you to have, copies, have backups, things like that, and be able to manage and organize things correctly. Because if you get an audit, you got to ask yourself, do I want to scan hundreds and hundreds of documents to email or upload to the auditor? Or do I want to just go to some system like with VF and download it and I can just email the attachment, right? So I'd say with pre-employment, the most important thing is having locations available for you to do it quickly to ensure drivers can be hired quickly and compliantly, and having electronic chain of custodies. Those are really the most important things.
And I'll just add that to that a little bit. If there's not a valid medical card, get an electronic physical and electronic result of a breath alcohol screen. All can be done through Verified First. So you have a copy of that result at your fingertips rather than having to upload, as Alex said, or scan. I don't know if anyone scans anything, but oh my gosh. Hopefully you don't have to scan anything, but that's the access the networks can provide to you.
Yep.
Great. Thank you, guys. Moving on. We got a question I think we can answer after, but well, let's answer it now. So I'll ask you guys now. So you have to have the result and the paper CCF.
Yeah, so you have to have the CCF would be and Grant, you can probably speak better because Grant's the lingo on that. But yeah, the CCF on the results, you have to have a negative test result for that driver before they can start operating the vehicle.
Yeah, that will accompany the result. You'll get a copy of the CCF, the electronic CCF, and the official results certificate per everyone's file.
Yep.
Thank you, guys. Moving on to on-site testing. What do you guys think about on-site testing and how that is playing into, kind of the modern
Yeah.
year?
Yeah. Well, Grant could probably speak a little on it too. I'll just say from the DOT side, I think on-site testing has two really good use cases. The first one's going to be if you're a very large enterprise company, if you're a huge warehouse or construction company or, manufacturing, something like that, where you've got hundreds of employees on site, being able to schedule something where, let's say I'm a manager, I just say, hey, we've got a drug test. Obviously, you don't tell the employees, but you just know, hey, on Monday at 8 a.m., someone's going to come in, do all the randoms for this quarter. My job is just to tell the employees, hey, everyone that's in a safety sensitive position, go to the break room at 8 a.m., right? Stand in there, you wait for the collector to show up, give names, they go get all tested, knocked out. That is so much easier than having a list of, 100 drivers and you got to call and email and text and go through all the workflow of that. So on-site's really good for that. On-site can also be good if you've got multiple locations. So we have a lot of clients that, they might have a manufacturing facility up the road, they might have fulfillment up the road, or they might have multiple job sites and then a main HQ. So if you're in construction, you got 3, 4, 5 different job sites, instead of having all your people leave the job site, which is obviously not cost effective, you can have the collector go to that job site and get all of it done. And once again, the nice thing is it's going to be electronically uploaded to your verified first portal. So all of the results are going to be uploaded. You just download and save those. So on-site's a really good option. Like I said, if you've got multiple locations or it's job site sensitive, so to speak, and or you've just got a lot of people. Grant, I'm sure you can add a lot more of that with your background too.
Yeah, it's a case by case scenario. If you have a pool of employees that need to be tested at once, oftentimes it is better to have somebody come to you. You have to weigh the expense because it's not free. It adds a little bit to the cost, but versus sending one employee or a pool of employees to a clinic, then you're out that time of however long it takes them to get to a clinic. So for randoms, it can definitely be a benefit if you have a listing, a pull from your pool, if we're doing randoms of somebody going on site, and how they do it can be a various ways. Sometimes they even pull up with a trailer, but that's the benefit for doing randoms. It is available, and we do have that option for you. I just saw a note pull up, and I was going to hit on it for post accident. Oftentimes, it depends on the severity of the incident. So if somebody's in the ER, yeah, on-site is definitely better because you go to them. Our collectors can go to the hospital or to the ER. They're not going to get in the way of the doctors trying to keep your person alive. That's the ER's job. But whenever the time is efficient and sufficient, they'll do a drug screen collection post accident. If it's a Band-Aid like type of thing, then you probably could just send them to a clinic and not have the costs associated with it. So it is definitely a case by case scenario of the severity of the injury.
Yeah. And real quick, Jay, I'm just gonna want to. Jamie had a question on post accident. So yes, we do have post accident. There's two types. One is going to be during hours, and one is going to be after hours. So most locations, keep in mind this is case by case. Depends on where they are, but most collection facilities are going to be open somewhere around 8 or 9 a.m. to around 4 or 5 p.m. So if it's during hours, all you would do with verified first is you just order the drug test and you just put the reason as post accident, and they can go to those facilities during hours. If it's after hours, then we do have an emergency collection after hours where we can actually have a collector dispatched to that site, that location. Obviously, that is more expensive, but we do have both options.
Awesome. Thank you, guys. Quick question now for everyone, just kind of everything we've talked about, around your current provider for drug and alcohol screening. And you guys should hopefully see the poll, and we'll see those results coming in. And Molly, we have your question. I think it's a really good one that we'll kind of save for the end as well.
Yeah, and I'm curious everyone's thoughts on this with their drug testing on this, because it's obviously important. And a lot of the clients I'll talk to, drug testing is usually a big hang up for them if they're using verified first for maybe some drug testing but not all. That's another thing to go over is, do you guys have the right panels? That's something I see a lot of. We have some customers that think they're using a DOT drug testing panel, and they're not, and they don't even know it. So if you're not using the specific DOT drug testing panel, even if you're getting a drug test, you're out of compliance. It has to be a DOT drug testing panel.
Just my 2 cents on that as well. A lot of clients have relationships with a local clinic or local clinic network also, and chances are great they're within our network of providers as well.
So thank you, guys. And moving on. I think this is a little timely based on what we've discussed, but post-accident testing, what are those kind of common pitfalls and how do you address some of them?
Yeah, so for post accident, There's kind of a couple things to go with that. That's going to fall under Regulation 382-303. And the best way to kind of summarize it is going to be after a test, you're supposed to have there it is. I was looking for that one. So I didn't have to scroll on my notes. But yeah, you have to do the alcohol test is usually done within 2 hours if possible, no later than 8. Drug testing is going to be within 32 hours. A lot of this really dictates the severity of the crash. The nice thing is that usually there's going to be an officer at the scene of the crash. They're going to kind of help explain some of this. So if it is some type of DOT or CMV crash, the auditor, sorry, not the auditor, the officer is going to let you know, hey, so-and-so's got a test. Here's what'll happen. Here's, kind of the steps. So they'll kind of help guide you with that. But the catch to that is that you've got to have those policies and procedures in place. You've got to have some type of post-accident in your company's drug and alcohol policy. And then you got to have some type of SOP. So, okay, what do we do if someone does get into an accident during hours or after hours? Do we have the ability to meet these regulation requirements, get an alcohol test within 8 hours, and get the drug test done? So that all kind of just plays back into having the right DOT drug testing program set up, making sure you've got the right systems in place for that. Grant, do you have anything you want to add to that?
On the previous slide, I want you to define what disabling damage is down at the bottom.
Yeah, so that's a really great question. So disabling damage by the DOT reg term means the vehicle is inoperable. So that's really important because when the officer does a post accident form, and there's a couple different names for it, that's kind of the common one, but when they'll use that, that's very important because that has to do with your safety rating. So if when they put it on there, one of the questions on the safety rating is, was it inoperable, and was there any vehicles that had to be towed? Towed is one severity weight point as far as the threshold of it. It's still severe, but it's not super severe. If it is inoperable, it's a different type of violation in the accident. So in other words, when they give a summary of the accident findings, if it had to be towed because of cosmetic, there was a bump or something, they want to get it towed to a body repair shop, that is less severe than, hey, it couldn't start, it wasn't operable. So that's the point with the regs is if the vehicle was inoperable, it could not start, it could not move, then that is considered inoperable by DOT reg term.
Thank you. And you kind of talked a little bit about this, Grant, but with everything we've kind of led up to this point, random testing such a huge component of it. Talk about that for a little bit.
Yeah, post-hire, that's the compliance side. DOT has, as Alex alluded to earlier, black and white regulations. 50% of your DOT drivers have to be drug tested. And we have a randoms program. If you have 15 or more drivers, you can be in an independent pool, meaning you get special attention. If you have less than that, you can join a consortium. But by the end of the year, 50% of your drivers are going to be tested for drug screens. And Alex, the alcohol testing is
10%.
10%. I didn't want to say the wrong one. So that's also combined for the randoms. And so what we want to do is help you be compliant every quarter so that at the end of the year, you've hit your numbers for 50% drug, 10% alcohol. When you have a pool of employees, you send them to us and we pull the randoms for you, whether it's an independent pool or consortium. And we're going to match the 50 and 10%. When somebody, to hit your 10% alcohol testing, it's actually the same person. So we're not going to screen more people. We're going to hit the 50% drug screening and add those 10% to the existing polls from your pool onto the drug screen for your alcohol test. We just want to make sure you're compliant at the end of the year. That's our goal, pre and post employment.
Yeah, and one thing to just kind of add to that too, auditors handle random drug testing kind of different case by case, once again, depending on how severe the audit or investigation is. Usually at a minimum, they're going to ask for the last 2 quarters.
So that would look like, hey, we need to see the last 2 quarters of selections. So they want to see who was selected, who wasn't selected, and then they'll want to see the results of that. That's usually at the minimum. The more severe ones, they might go a year or farther. And the point to that is this goes back to record keeping, which is all part of Regulation 391, is going to be if you're enrolled in any type of random drug testing, a lot of companies will go, well, we're enrolled, so we're good. Well, there's certain records you have to have. You have to have what's called, oh, I'm drawing a blank, of course, now that I have to name it, but it's a quarterly selection. So the idea is you're gonna get some type of email notification, something, hopefully not a letter, but some type of email saying, hey, here for your quarterly selection, here's who was and wasn't selected. And if there was no one selected, you need something just saying, hey, there was no selections this quarter. If you're not getting something formal like that, you're at risk of being out of compliance, because how are you going to show an auditor, hey, we were or weren't selected, right? So something to really keep in mind when it comes to random drug testing.
Perfect. Thank you. We've talked about drug testing, accident, post-accident. What can you guys tell the audience a little bit about, like, the return to duty process and how to navigate that?
Yeah, so this is something really near and dear to my heart, because we've had return to duty has been a big challenge for the industry. As far as the return to duty goes, the flow is pretty straightforward. I'll just kind of outline it for everyone. So if you have a driver that has a positive or non-negative, drug test, then what they have to do is they have to complete what's called an SAP course or consultation. It's pretty much with an approved substance abuse professional, like, the slide shows, and they're going to determine how severe they think that testing needs to be. When they're done with that, they're pretty much going to send the employer and the driver a letter saying, hey, they are eligible to have a return to duty test. Once that's done, there's a follow-up testing plan. That is at the discretion of the SAP provider. They could say they need to be randomly drug tested once a month for a year, 2 years, 3 years. They could say quarterly. It's totally at their discretion how they decide to do that. Now, where that gets tricky is if you have a driver that once they complete the return to duty, then what would happen is it's up to the employer to make, and this also goes for contractors, for owner operators, just so everyone knows. So any driver, owner operator, contractor, it's at the employer's responsibility to make sure that those drug tests are being met. Because in the event of an audit or investigation, they're going to see you have an SAP driver, and they're going to want to see a lot more records. So if the driver has to complete a random drug test, let's say every month for whatever time frame it is, they're going to want to see records for that. So you have to be able to show that. So just something to kind of set the stage on what auditors look for and what the responsibilities are for employers.
Thank you, Alex. Really, as a whole, we've talked about a bunch of compliance gaps. How would you kind of sum up everything we've talked about up to this point?
I would say really just, once again, having the ability to have a very large network option for testing, making sure you have electronic chain of custodies, everything's electronic, not allowing paper to potentially be that chink in your armor, so to speak. And then having really good random drug testing. So having communication, knowing when randoms are being placed, what your responsibilities are and aren't, making sure you can handle an SAP driver if you have one, and also having the right policies and procedures in place for, post-accident, post-incident, and just having a full DOT compliant drug testing program is incredibly important, because ultimately, when it comes to audits and investigations, there's only a couple sections of the regulations that there's just no flexibility. They're the most severe, they're the most expensive, and one of those is drug testing. So that's your biggest liability as far as cost goes. And the other thing to talk about is also insurance. If insurance companies are seeing,
because a lot of this stuff is public information. So when you're going through underwriting, if they're seeing that you have drivers that have drug and alcohol violations or things like that, you're going to pay a fortune in premiums compared to a company that doesn't. So having the right systems in place to make sure the drivers are safe, you're screening and hiring right, and you have everything in place to manage that is really, really crucial.
Yeah, we're going to go over a list of what the DOT calls their checklist. And we have all of the products within the DOT checklist for the compliance side. And so if you're just doing a DOT drug screen through us, or maybe a DOT drug screen and a physical, there's a lot more products to be compliant on the back end. And yeah, good segue, huh? To the next slide. So there's a lot of gaps. There's a lot of holes to fill to make sure the driver going down the road is compliant when they get pulled over or when you get audited. They're going to ask for a few things. They're going to ask for a lot of things. As Alex said, also, they could ask for one thing for 20 drivers, or they could ask for all things for all your fleet. You never know. And so it is simple as an MVR or running the clearinghouse query. That's what we want to provide for you guys to make sure that when something happens, it's about risk mitigation and managing that risk in the future to be compliant when something happens. It's going to happen. So we want to make sure that you're prepared for it. I saw a question about a company uses us for onboarding and then the post-accident compliance side. Thankfully, we have partnered with the largest networks for the compliance side, for the randoms. Even our networks of clinics are vast. So between eScreen and FormFox and Quest and LabCorp, those are the largest networks in the country. And thankfully, we have a relationship with all of them. And so hopefully we can find you a location that can service your driver, because they could be in the middle of nowhere, Montana, and we got to figure it out for you.
Awesome. Thank you, guys. I think one of the things that, to wrap, everything that we've talked about up, we launched that poll earlier in the presentation, talking about audit readiness, and most people, said they could confidently provide, about the 3 years of drug and alcohol testing history for drivers. But on the flip side of that, when we looked on how prepared is your organization for a safety audit, most of the people answered somewhat prepared or not prepared or unsure what would be required. How does something like being almost single source with someone like Verified First kind of help that, so you're not going to a bunch of different providers for your DOT products, help that process? Because if you're unsure of what's required, we should be able to guide, someone prospectively. Is that correct?
Yeah, absolutely. And that's the big thing is when, for all of our existing clients with Verified First, and anyone that's interested to become a client, when I get involved with a client, we go through a start to finish, workflow, scope of work of, hey, here's what you guys are currently doing. What can we do to improve it, make it better, ensure compliance, of course, and make sure that it's a good setup for everybody. Because a lot of the times, there's HR people involved. Sometimes there's a recruiter involved. There might be a fleet person involved. So there's all these different people involved, usually with these DOT operations. So making sure there's a good workflow that ensures compliance is really important, because there are so many people usually touching a file, so to speak.
Mhm.
And if we're all good, what I would like to do here is transition kind of to the open Q&A section. What I'll do is I'll kind of address the Q&As both in the Q&A function and in chat, and kick it to you, Alex and Grant, and we can kind of go from there.
Okay, perfect.
All right, so to kind of start, one of the ones all the way back from the beginning was, we do non-CDL medical exams without drug testing. Can they use Verified First without ordering a drug screen too?
I mean, yeah,
You can.
yeah, you can. I will say if it's a non-DOT, and Grant, you could probably answer this better than I could, but if it's non-DOT physical, from the best of my understanding, there usually isn't a drug test involved with that. For the DOT physicals, usually there is. I believe it's at the discretion of the examiner. Is that right, Grant?
Well, that's going to be policy for non-CDL. If non-DOT physicals is our #1 product for occupational medicine, just to let the audience know. Our clients order thousands of them and thousands and thousands. It's a DOT lookalike physical. And so it's going to make sure you are in a healthy status to operate whatever you need to operate or function at your job, like really. But it's not under the DOT umbrella. It's just a lookalike. For the drug screen, for the non-CDL, just a recommendation. Obviously, I'm not an attorney, but we could recommend a non-DOT or a DOT lookalike drug screen panel, which is still going to mimic what the DOT does. And you can always implement that since it's non-CDL. But the non-DOT physical, we do those all day long.
Yeah. Thank you, guys. Okay, going back to one from the chat, what is the best way to meet these needs with contract drivers, considering that they have their own DOT and MC numbers and operate under their own authority?
Yeah, so this is a great question. So I'll just go directly off the regs. So to answer that, so regulation 376.12C, when a carrier leases an owner operator's equipment, the carrier has exclusive possession, control, and responsibility for the equipment and the driver during the lease term. So in other words, that's the main one. Regulation 382.103 states that every CDL driver operating a CMV in commerce, including lease owner operators, is subject to DOT drug and alcohol testing, and 391.51 covers it as well. So kind of to summarize it, it is your liability. So if I'm leased onto a carrier for their authority, or even if I have my own authority and I'm leased on you to help me with dispatching or whatever it may be, if I get into an accident, I am your liability. If I have a positive drug test, I am your liability. So the responsibility of that carrier is to make sure I'm compliant. I have drug testing. I have my driver qualification files. I have all the stuff that pretty much you treat me no different than if I was a company driver. The only real difference is if I'm an owner operator, I might have my own equipment, like I was saying, but as far as who's liable, it is still 100% the carrier's responsibility.
So Alex, I've got my own truck, but I'm hauling your stuff. Now I'm under your roof.
Yep, you're my responsibility. So I have to make sure you can pass a drug test. I have to make sure I query you, MVR, all that stuff. And one thing too, I've seen this go bad so many times in audits where I'll see companies go, oh, well, we have the owner operators do that. So we have the owner operators do the drug tests. We have them do physicals. You do not want that. The reason is people aren't always honest, number one. Of course, I'm not an attorney, but what I've seen with audits is if you get into an audit and a driver says, don't worry, I can pass a drug test, I just did one. Well, how do you get a copy of that? How do you know? So if you're the one initiating the order, you get the results, you can see the paper trail. That's what you need because you're responsible. So now as far as the billing goes, that's between you. If you want to have them reimburse you or you take it out of their pay or whatever, that's just a company policy. You can do that however you want, but you want to have as much control of that process as possible because once again, it's your liability.
Awesome. Thank you, guys. Real quick note, for people asking for a printed copy of the webinar or a recording, you will receive a recording 24 hours after the event ends. It'll be automated through Zoom. You should receive a link to that. And then for everyone who asked for the checklist, yes, we'll include a link to download our DOT checklist with that. You'll basically just have to fill out a form and then be able to download it there. Also, if you guys still have the invite emails, it's on there as well as like a second level content. If you wanted it sooner, you can go back and download it from there as well. Back to some of the questions. This is kind of a two-parter. Is the DOT panel required for non-CDL drivers? If not, is it okay to still use for a driver?
So as far as non-CDL drivers go, yes, you can use any drug testing panel you want. for a non-CDL driver. That's based on company policies and procedures. That's really just at your discretion what you prefer. What I usually recommend, because the gold standard is going to be a DOT panel, I just recommend you do a DOT, regular urine panel 5 or just a DOT lookalike. Grant, I'm sure you could speak more to that, but that's just kind of my recommendations.
Yeah, DOT or DOT lookalike for the non-CDL is a great standard. The DOT set it for a reason, so mimic it for all of your non-CDL.
Yep.
And to kind of follow up on that, can a 10-panel test be used for a non-CDL driver for random or post-accident testing?
Oh man, I'd love to talk to the person that chimed in about the 10-panel. I'm a drug testing nerd. My
This is
background
true. Can
has
attest to that.
been drug testing in Occ Health for 25 years. Just to throw it out there, 2 of those drugs in a standard 10-panel don't exist anymore. That's propoxyphene and methaqualone. So you can test for relevant drugs. Love to talk to you about that. Short answer is, yeah, you can still test for a 10-panel. You may not get in your money's worth by testing for those 2 drugs that don't exist. Love to talk to you about that as well. But yeah, you can use a 10-panel, standard 10-panel.
Thank you, Grant. Does a CMV driver need to take a drug and alcohol test if they are in a DOT recordable accident?
So if they are a CDL driver and there is any type of injury or fatality, hopefully that never happens. So any type of injury, fatality, or the vehicle is inoperable, or there is a citation issued, which usually if it's inoperable, there's going to be, then yes, they have to take a post-accident drug test. If they are non-CDL, then the officers will usually not require that. There's some state laws and regulations I'm not going to get into because I'm not familiar with them and I'm not an attorney. But on the CDL side, that's the answer for that part.
The answer is yes.
Yeah.
For your company policy, that's up to you guys. For non-CDL, advice would be, yeah, you want to make sure you drug and alcohol test with that person for the liability.
Yep.
Great. Thank you, guys. Moving on. How often are random drug tests required?
That's a great question. So how it works is it's done every quarter. You have to have a 50% drug test and 10% breath alcohol. That is per annual requirement, and that's just broken up over the course of every quarter. So just to keep it really simple, if you had 40 drivers, you'd have to have 20 of those every year randomly drug tested, and 4 of those would be breath alcohol. So out of those 20, that would just look like 5 drivers every quarter are selected for a random drug test.
Perfect. Thank you. Does Verified First offer any assistance with international compliance?
Oh boy.
I'll let Grant answer that.
Yeah, we'll have to see where you're going. Down into Mexico, up into Canada, we can probably lend a hand. It's a country by country regulation. We have to see where you're going. Your attorneys need to tell us where you need to go, where you need to test. It's so different when you leave the U.S. border on what is required by each country and each nation. We have opportunities to grow. I'd love to grow with you where you want to go. So I'll leave it out there. Let's talk.
Another one. I do reasonable suspicion training for supervisors? How often do they need to be trained / certified? Also, do all safety sensitive employees need a drug-free workplace training?
Oh boy. So that's one of the great parts of the regs. I do not remember it off the top of my head. I believe it's 382 2 something. So there is nothing, and I want to say this carefully because I like I said, I don't remember the reg off the top of my head.
from what I remember, there's nothing that clearly states you need to have reasonable suspicion training. Now, the catch to that is it's a bit of a gray area. It doesn't say you need it, but it says you have to implement it. So, for example, the government's pretty much saying there is not a set standard of, hey, here is the course you have to do for reasonable suspicion. The government is never going to endorse private business. They're never going to say go to this company to, do reasonable suspicion. They're going to say a company has to have reasonable suspicion training and be aware of it, but they're not going to say you specifically have to have it with this company, if that makes sense. So to answer it, a company has to have a drug and alcohol policy, and they have to have in that drug and alcohol policy what their policies and procedures are on reasonable drug testing. So what is that? How is it defined? How do you handle it?
Yeah, and also I would probably refer back to associations like NDASA, NDASA, National Drug and Alcohol Screening Industry Association. That's the old DASA. But NDASA, those are the rulers of the world for providing reasonable suspicion, those type of training and events. I've gone to them for over 20 years myself. I'd check out that resource.
Perfect. Thank you, guys. One more here. If they are CDL and none of the rules apply, can a DOT drug test still be done?
If they're CDL, one more time, Jacob.
If
Yeah.
they are CDL and none of the rules apply, can a DOT drug test still be done?
If they're CDL, all the rules apply.
Mhm.
I think the question is if they're CDL, but if they're CDL, but they're not having to use their CDL, is that what it's trying to say? Like,
Yeah, for a post-accident, Marva, if you can clarify that a little bit.
Maybe they're in a non-safety sensitive position at the time of the incident.
Yeah.
Not sure how to answer that one.
Yeah.
Yeah, if you want to try and flesh that out a little bit, Marva, we'll try and do a better job of answering it. But thank you for that. I've got a couple more here in the chat. In terms of somebody who would like to get some information on VF, they're not happy with their current consortium. They currently have FMCSA workers as well as PIMSA workers, so they manage both. We do actually offer, we have a partnership with a company that offers a PIMSA a guide as well. That might be of use to you, Laura.
Yeah,
Wanted to call that out.
there's obviously multiple modalities under the DOT. We can help be compliant with all the modalities, especially for the pre-employment and the randoms, to make sure that you're hitting the right numbers by the end of the year. PIMSA is not that far off from FMCSA. And so let's chat about that as well. We can certainly take you under our wing.
Yeah, absolutely. And I think kind of a follow-up to that question was, do you guys do the history check, or is that something we would have to do on our own? So I think that's more about Verified First's kind of suite of services, which I know we can talk about a little bit more in depth.
And Rohit, I wanted to go back to that reasonable suspicion question. I did look the regs up. We had a little time. So 382.603, it lays out, really important keyword there, lays out. So it doesn't say, once again, black and white. It's like a recommendation. So it lays out the mandatory reasonable suspicion training requirements for supervisors. So what it's pretty much saying is we're not going to say you have to use this company for reasonable suspicion. We're saying the layout is your supervisor has to be aware of how to handle and conduct reasonable suspicion training. So it's saying they have to have 60 minutes for alcohol, 60 minutes for drugs, and pretty much a layout of, hey, here's our company policy. I'm the supervisor. I'm aware of what to look for, how to handle that, and how it's applicable for our organization.
Perfect. Awesome, Alex. Thank you for doing that. But just to pivot real back quick to the history check, is that something that we would be able to do, or would they do it on our own?
Yes, so on the history check, are we talking about the DOT, VOEs, and SPHs? So that's going to be the verification of employment and the safety performance history. Is that what we're referring to? Because if it is, then yes, we do offer that. And just so everyone knows, I've seen a lot of different providers out there. I've seen, I mean, pretty much every type of SPH and VOE you can think of from every vendor. And this is not a sales pitch, it's just what I've seen. Verified First has by far the best and most successful SPHs I've seen. We have well over a 90% success rate. Most companies, if they're in the 50%, they're ecstatic. So we have the highest success rate on getting those back. And to answer that, so I saw the Marvin, the Sean one on the whole CDL one. I'm assuming this is the question. So the question is, if I'm wrong, please let me know. But the question is, if they have a CDL, but the type of equipment they're operating does not require a CDL, do they still have to have, the drug testing? So the answer is no. If you have a CDL driver, they're operating a cargo van or any type of equipment that does not require a CDL to operate, then no, the FMCSA is not going to require you to drug test them or query or any of that because they're not operating a vehicle that requires a CDL.
Perfect. I think that addressed Sean's question. Marva actually had some clarification that, they are a CDL driver, they get into an accident, none of the rules apply in order for a DOT post-accident drug test. Can they still do the DOT drug test? They are still operating CDL equipment.
Oh, yeah. So the question is, they're a CDL operator. They are operating a CDL vehicle, but they're not. So in other words, there was no injuries or anything or citations issued. Can they still do a post-accident test? Yes, you can. That would just be in your company drug and alcohol policy. That's pretty much, best practices. Hey, anytime you're operating a company vehicle and you're a CDL holder, if you get into an accident, regardless if you're at fault or not, we do a drug test. That's just best practice.
It's best practice and a great way to mitigate risk.
I want to have we have another question. I also want to have like kind of an opinion that somebody asked into the chat. What are your thoughts on the DOT adding fentanyl to the DOT urine panel?
My thoughts? I'm a big fan. Fentanyl is a dangerous, addictive drug. I love the chatter right now about DOT accepting fentanyl or adding it to the panel to be relevant. It's 2025. Absolutely a big fan. It can only be done by a urine test. And so it kind of excludes today the oral fluid chatter also. But they have not adopted that either. So it's kind of not relevant also. But big fan of adding fentanyl. Very dangerous, widespread drug. You should definitely add it. DOT, they're not listening right now, but I am. And I hope they make that change.
Yep, and I will second that all the way.
Thank you, guys. Couple questions that popped in. You had somebody who's working for a company that didn't have the most stringent following of DOT compliance regulations. So their ask is, what is their best bet to get caught up and compliant if they weren't previously following those regulations? Do they need to try and go backwards as much as possible, or should they just correct and move forward with what we have?
Yeah, that's a great question. And thank you for asking it because I know sometimes those hard questions, it's, we got to do something, but what do we do? So thank you for that. I would say this is case by case. Best answer is get on a call with me. I can walk you through it. The most important thing is usually what I'll look at is, hey, what is the most, what is the most out of compliance, most severe violation you could run into on an audit or investigation? We focus on that first and work backward. So that's going to be case by case. Let's have a conversation and we can go through that. That'd be my advice.
Yeah, but you also got to start. So it's almost like from today forward, here's what you're going to do. And then let's also mend the past. But let's start like tomorrow. Here's your plan of action and a corrective action plan before something bad happens. I'm going to implement this tomorrow. So I know from at least today forward I'm going to be compliant, and we can clean up the past.
Yep. Yeah, and exactly. And that's kind of what I was meaning is we gotta figure out what you're missing right now, plan the path forward to make sure you are compliant, and then just document what we can in the past and go from there. So
Auditors will see an improvement. Auditors will say, oh, great, from September 18th moving forward, you've implemented all these things. They're going to be happier than that. Than if you have not done anything, but you knew it. So it's all about making the auditor a little bit happier when that happens. Again, getting a slap on the wrist is a lot better than getting enormous financial fines.
Yep, absolutely.
Great point. Just a couple quick ones to try and fit in before we wrap things up. What does DOT recommend we use for selecting employees for at random testing?
Oh boy, Grant, I'll let you answer that because you know the software better than I do.
Oh, it's completely anonymous. We strongly recommend a third party run it. Don't try to run it internally because then you can play favorites. Well, Alex, you were in charge of the random pool, and it's amazing you've never been pulled. Those things happen in the drug testing world, so get a third party involved. If it's not us, make sure it's a third party administrator. Multiple companies can do this on your behalf and for you. The important part is that you follow the compliance guidelines of the 50% and 10%, but make sure you get that done. And when we say quarterly for all the audience also, you send in your pool of your random list to that third party. Maybe it's us. Hopefully it's us. And then by the end of the quarter before the next quarter starts, we give you the poll from your pool. You don't have to test them tomorrow. So if you have 100 drivers and we're looking at 10% or 50%, you don't have to pull them as soon as you get it. You have the entire quarter to manage that situation. So here's your poll of, let's say it's, I don't know, 10 drivers today. That does not mean tomorrow you have to notify them. You want to notify your drivers of the random the day that they're going to go get tested. So if you have a driver in the middle of nowhere, Montana, probably today is not a good day. But when you know that they're going to be looping through Denver on their route, you're going to catch them in Denver and say, you should go to a clinic today. You've been pulled for a random. Once they've been verbally notified and acknowledged that they've been pulled for a random, they need to go there now. It's not like, oh, by the end of the day, you need to get it done. No, you kind of need to stop what you're doing and get to the clinic like as soon as possible. So I could keep talking and talking, but the randoms are the notification of the randoms and the amount of time or the window to get to a clinic is up to you, of course, but the strong best practice is I've notified Alex he needs to go now. I expect Alex to get to a clinic within the next 4 hours of going to go take your drug screen, and we can manage that window electronically as well.
Thank you, Grant. Two quick ones, I think, to try and get in under the gun here. We do work at airports in New York and are required to administer drug tests. What are the requirements for people that aren't CDL drivers?
Oh boy. This is a whole can of worms.
Yeah, I'm gonna say we're not attorneys.
Yeah.
So go with compliance for the state.
Yeah.
Go ahead, Alex.
Yeah, so this is a whole crossover between FAA, FTA, and FMCSA. One thing just to throw out there, a lot of companies will say we are not interstate. We do not meet the federal requirements because we don't cross state lines. There is a subsection for that reg that if anything you are transporting, picking up to and from locations crosses or touches international facilities, which is a port, an airport, you are considered interstate. So the answer to that is I would need to know a little bit more on it, honestly. And once again, not an attorney. If you are non-CDL and you're going to airports, FMCSA is not going to require you to drug test them if you're not operating CDL equipment. But FTA might, FAA might. So there's some areas there I would need to talk to some people and check the regs on. But from an FMCSA standpoint, if they're not operating a CDL vehicle and don't have a CDL, then
there's no drug testing.
Perfect. Thanks, Alex. I think that might be something we'll follow up on. The person clarified, they don't transport anything. They're working in an admin capacity.
Okay.
So that might give us a clear vision when we're reaching out to kind of clarify that stuff.
Yeah. Yeah.
Real quick, if you guys could answer these as much as you can. I know we're going probably a little bit over, but that's okay if you guys want to stick around, and we'll try and get to these two questions real quick. This one's the second part of an earlier question. Do all safety sensitive employees need a drug fleet? Let me restart that one. It's the end of the webinar. Do all safety sensitive employees need a drug-free workplace training, as in testing procedures, drug and alcohol education, SAP process, etc.?
So that is once again, talk to an attorney about that. As far as CDL drivers go, yes, you have to have drug and alcohol policy, safety sensitive training, things like that. If they are non-CDL, that is up to your attorneys, HR professionals, company policy, things like that.
Yeah, it all comes down to their policies and acknowledging the employee has to acknowledge that they've read the rules and regulations and policies of your employment.
Yep.
Great. Thank you, guys. Last one. If you have 100 employees and you do 50 of those, are those 50 then divided into each quarter, meaning 12, 13 per quarter? I think talking about, the random program.
Oh, it's truly random. So yeah, it's not going to pull 50 right off the bat. It is spread out throughout the year.
Yep.
But just keep in mind, if I'm in that pool of people getting pulled, I can get pulled every quarter. So that doesn't mean eliminate me from the next quarter. It's truly random.
Yeah.
Yep.
Just as an example, verified first, obviously we wouldn't be, we live this out, have this happen to us as well. We can get drug tested, even though there's a huge, amount of our employees that you can get picked 3 times in a row or 0.
Mhm.
It just is truly random that way.
Yep.
With that, I just want to say thank you to everyone who stuck around for the end and watched the entire presentation. Real quick, I have the schedule consult there, but we'll also be able to reach out if you need in the post event survey that you see there. If you need anything, you'll also receive the recording, like I said, 24 hours from now. We do have a follow-up event next week, specifically around DOT employment verification. It's more of a quick hitter. It's 30 minutes. It's really less a presentation and more just an open discussion around anything, relating to that particular topic and anything in the industry as well. So if you want, you can go check out the Know Your Screens from Verified First as well, and we can continue any sort of conversations. But again, thank you to everyone. Thank you to Alex. Thank you to Grant for being here and answering those questions and taking us through everything. I really appreciate it. And everyone, have a great rest of your day, and talk to you soon.
All right. Thanks, everyone.